ask you one of the questions that I've been asked to really put to you. Do you think that doctors currently have a seat at the table in this whole healthcare debate?
Well, the Medical Association, our president, Todd Williamson, has been up to the to address Congress on at least 2 different occasions. So the Medical Association of Georgia has become a state organization which has really progressed into on the national scene and helping to represent 48,000 physicians from different states and different societies. We do have a place at the table. We just feel that some of the players that are at the table right now are not reflecting a lot of the issues that we have concerns with. Okay, the American Medical Association has gone on record, the ACP, the Family Practice have gone on record to support the bill, but they have made tremendous amounts of concessions. Now we feel, you were talking about how you can develop healthcare. We believe that we should try to get those 50 million people on insurance. And the way you do that, we feel that the way the funding for healthcare is broken. It needs to be fixed.
Absolutely.
And that and having said that, there are different ways that you can do it. You can provide tax incentives so that people can own their own insurance. They have their insurance. They have their insurance for life. There's no clause that prevents you from having, if you have a pre-existing condition. Insurance companies have cherry-picked, as you've known, over the years. They have just taken what they have. If you have a condition, you get a problem, all of a sudden they jack up the price. Right. And I always say, it's just like my grandfather used to say, you know, with healthcare, everybody wants to jump on the bandwagon. We need to get healthcare. Right. The one thing you have to realize, it doesn't mean that you're going to be accessible. Right. You look at Massachusetts, you look at Medicaid. People cannot be seen on the Medicaid because they've got the price down so low. So we have to put in the finances to make it so that patients can be seen, not just give them coverage and then they can't be seen, and not be in a situation where you're using comparative effective research to be cost-effective research. That's the big thing. If you were sure that the physician was making the choice, the decision of what needs to be done, and helping the patient to make that decision, then that's okay. We're okay with best practices, practice guidelines, and those things like that by specialty societies.